Hello and welcome to the program Out in Front. In search for a better life, he was unconsciously searching for the solution to the many problems that his community was grappling with, one of which is mental disorder. Regarded often as a curse and not a health priority in Cameroon, Dr. Nicolas Santos, a resident counseling and clinical psychologist based in California, United States of America, had to take action to reshape mentalities and provide a solution. Born on May 29, 1972, Dr. Nicolas Santos hails from Bamenda, northwest region of Cameroon. He is married to Yvonne Gu, and together they have 4 children. Hello and welcome to the program, Doctor.
Thank you very much. It's my pleasure being here.
Dr. Nicolas Santos, you've had a very vibrant and brilliant academic, professional, and social life. From the University of Boya in 1993-94, traveling all over Europe, and then back to America in 2006. You want to tell me about this phase of your life?
Let me begin with my life history, which ultimately began in the University of Boya when I had my bachelor's degree from the first batch of graduates of the University of Boya in 1993, and then between 1993 and 96. And I was also the student leader at the university. I was the auditor-in-chief of the Pioneer Student Union government. And when I left the University of Boya, I did some other maritime management job with Limbe Port Company and Douala Seaport. And from there, I became a marine officer that took me to many countries in the world. And I was in Germany, Holland, Belgium, and France. And I speak German and Netherlands. I was there for basically 8 years, and I moved back to Cameroon. That's when I met my wife, and we had 3 children. Then I decided to come over to the United States of America for greener pastures. And they, in under 3 years' time, joined me in the United States of America, where I'm living happily. That has been it, but I also went back to do my master's degree at Capella University, where I had a master's in psychology with specialization in counseling, and then was moved over to the Chicago School of Professional Psychology in Irvine, where I'm a resident doctorate clinical psychologist under the American Psychiatric Association.
You arrived in the U.S. in 2006, as you said, and you enrolled in the Chicago School of Professional Psychology. You want to tell me what motivated you to take psychology as a specialty?
Yeah, growing up from childhood, I used to see the people who struggle with mental illness, who were left on their own in the streets of Cameroon. And that I did not see in any university or any hospital whereby they were given the maximum amount of care that I could one day love to be given to my dear one. And I think when I came over here and saw that the way these people are treated is quite good, and the way they get recovery is quite easy, and the medications that are being administered alongside the psychotherapy works extremely good. So I tried to do some homework about navigating the resources on how this is possible and feasible. And I came to discover that that was as ABC. So I decided to say, why not take advantage of bringing something new to Cameroon, whereby people can gain faster recovery in the mental health field, whereby those who are eating from trash bins in the streets and moving homelessly and removing their dresses can be rehabilitated and given the care they need and be reintegrated back into society as it happens in the United States. So this was principally my motivation into this field.
Tell me a little bit about your training as a psychologist. You want to explain to me all what it involves, but most of all, you want to tell me about your career, how your career unfolds.
I want to state one thing that acted as a driving factor towards this field that I got into. My father was a police traffic controller in Cameroon. When he used to come back from the police station, he used to keep all the notes from the police station on the table. As a kid, I used to read at them. And that made me to be scientific, factual, which means that I can look into a problem, diagnose a problem, evaluate a problem, research on a problem, and try to troubleshoot on that problem. And this is what it takes to be a good clinician. You have to have those diagnostic apparatuses. For example, if you look at here, I have a complete adult psychotherapy treatment planner. To be able to formulate a treatment plan for a mental disorder, or to be able to counsel a sick one, you must be able to, first of all, trace the history, do information gathering of all the processes from the genealogy, the history of this, the trajectory. And then you look at the pros and cons and look into what research has in terms of validity and reliability. Basically, when I was doing my master's degree at Capella University, we used to do what we call colleague-to-colleague counseling, whereby we'll organize sessions. Then one student will do a role play of a therapist, another will play the role of a client. Mm-hmm. So from there, we moved now to the community, whereby we started with engaging with clinics where we were placed as interns. So I worked in the Multicultural Counseling and Consulting Center in Maryland, in Belleville, Maryland, where I was seeing patients. I carried a 15-load client population of assorted diagnosis, from schizophrenia to bipolar to major depression. And I used to do therapy with them once in a week and report to the state, because some were mandated, some were on Medicare plan. Right now, I am a doctoral resident with the Chicago School of Professional Psychology, and we have the Chicago School Counseling Center, whereby we accept the population that is referred for counseling and mandated therapy. So we help to sort of diagnose what they are suffering with, put up a treatment plan, and try to work with them to restore them back so that they can be reintegrated into the normal population.
We noticed that you did a doctoral research or dissertation titled Challenges to Assertive Community Treatment of Patients with Schizophrenia in Nigeria. And you have been twice on United States budget, and precisely to Nigeria's World Health Organization's Research Center for Mental Illness. Now, before you want to tell me why you did that research in Nigeria and not Cameroon, you want to tell us a little bit about what you discovered in the field, what your discoveries about mental illness in Nigeria, which eventually boils down to Cameroon.
Okay, first and foremost, I would like to mention to you that the people who suffer from mental disorders in Nigeria are similar to the people who suffer mental disorders in Cameroon. Yeah. The reason for me having undertaken this research in Nigeria is because we lack the professional establishments and the archival sources of material and data on which I could convince my learned professors of the United States to pass me on a doctoral degree when I don't have the relevant academic and professional sources to cite my experiments on the field so far as schizophrenia is concerned. By this, I'm saying that Cameroon falls within an area that has no mental health policy in place. I take this as a challenge. I don't take this as a mockery to the Cameroon population. I take this as a challenge that it is for some of us to group up together and try to study or adventure into fields like this to try to come up with a mental health policy for the country. I take it as a challenge to set up a curriculum in the schools and universities of higher learning in Cameroon to manifest or to try to put in place a program in clinical psychology, counseling psychology, forensic psychology, neuropsychology, which are fields that are much more needed in the modern day society.
Now you're saying that you had a lot of shortcomings. That's why you took this research to Nigeria, and I believe that is one of the reasons why you created this non-governmental organization known as APSCAM.
Yes.
That is to get into the problems at hand and to find solutions to problems of mental disorder in Cameroon. Now you want to tell me the reason behind your work in APSCAM?
The reason for creating APSCAM and the reason for me undertaking this research in Nigeria are same. The research deals with the challenges in using assertive community treatment with schizophrenia patients in Nigeria, which typically deals with how feasible or how successful is combination treatment. Because another word, another alternative or synonym for community treatment is combination treatment. A combination treatment deals with how you can be able to, in a single setting, to practice Western psychotherapy, Western psychopharmacology, and the use of traditional medicines and spiritualism and folklore. In a nutshell, the practice of holistic medicines within a particular psychiatric or clinical psychological setup.
But
so, in a nutshell, let me come. In a nutshell, it means that what was in my research and the results of my research which prove that people will yield faster healing if several other approaches were used in the same sector than in a singular approach or a single approach of going the Western or the African system. So the Association of Psychological and Psychiatric Services of Cameroon is the first clinic in the world that is going to experience a setup, a clinical setup, whereby all these actors come together to derive a treatment plan for a mentally ill patient. In the sense that we're going to use Western medication, we're going to use Western psychotherapy, we're going to adhere to some spiritual exorcism and other things, and we're going to also incorporate some trado-herbal spiritual healers within all the traditional practitioner association of Cameroon. So I am seeing this as a groundbreaking research and a groundbreaking clinic that is coming back to Cameroon. We are going to be the first clinic whereby we are going to conduct a lot of research studies and try to make sure that everybody that comes to the clinic is given the appropriate care that he or she needs. We are not going to stick to one particular form of treatment, because to deny an African who believes typically in witchcraft his herbal drugs will be like refusing to take care of that African in that clinic. So what we are going to do is we are going to accept that what you have been taking has been working for you. But why can't we also try this now and see, and for you to rate the importance of this as opposed to this? That is the approach we are going to use. But the point is that we're going to be acceptable. Our clinic is going to be a receptance for everybody. And we are going to, the whole world has moved from a one system treatment model, be it in general hospitals one, to a holistic medicine model. And this theory of assertive community treatment is a theory that was developed in the Western world by Mary Ann Test and Stern as far back as in the 1900s, which we are only discovering it today because of my research. And if applicable to the Cameroonian situation, then I'm betting you and I'm telling you that we are going to be the deal breaker in the mental health field in Cameroon.
Now, you're just getting this non-governmental organization started, and you will definitely need some amount of financing, some amount of support. So how do you intend to get things moving on the ground?
When I began this, I began it as a one-person initiative. And I began it as a personal clinic of mine, my personal clinic. But as time is unfolding, I've seen many more people interested in the idea. In the United States, many of my friends have contacted me to see how they can join and become shareholders in it. But I would always like to retain 60% of it because this is my creation. And I think that there is no amount of financial or finances needed to jumpstart this that can be above me.
You have this very ambitious vision of eradicating mental illness in Cameroon by the year 2035, which kind of coincides with the time that Cameroon is definitely going to become an emerging nation. You want to tell me how you intend to go about this?
That's one of the cornerstone of this clinic and foundation that I'm trying to lay in place, because I've already taken moves towards legalizing this clinic with territorial administration and also with the delegation of public health in Douala, where we are supposed to start. And we plan to spread to 5 regions in the country, where we will have outpatient units in Garoua, in Bamenda, in Buea, and in Yaoundé. So we are, and then Douala is the head office. So we are planning an area whereby people with mental illnesses in the various regions can go over there and complain about a family member or themselves having such problems. And then it will be communicated to the head office in Douala. Then they will be conveyed to a psychiatric facility, which is under construction in Kumba. That is, we have a rehabilitation hospital. And when they are brought there, each and every patient that will come there will have a solution to his or her problem. Because let me tell you frankly that our greatest cause of mental illness in Africa is poverty. The inability to feed oneself, the inability to house yourself, the inability to find a job, graduating from school, and all those stressors are the first causes of mental illness in Africa. And if we could work hand in hand with public health and education to try to see how we can put in place some sort of community rehabilitation, vocational rehabilitation, housing project, and feeding, right up to feeding of some of these people, then their stressors will be limited and there will be limited mental illness in Cameroon. And for that, we're able not only to, we are working towards not only staying as a clinic, but also to recommend to the government or work with the government as a parastater, hand in hand, to identify the reasons for women removing their clothes in Douala in the streets, the reason for girls going to places to found naked in places because they went somewhere to take money to some sort of measure up in life. Because if we can be able to counsel them and we can be able to form units and go into schools, hospitals, prisons, institutions to work with the teachers and tell them, watch out, mental health is something that you guys have to concentrate on. It's not only psychological education to teach. This is terrible, because if you have to look at what mental health is all about in the present day world, no society, no Western community, or even some African and third world developing countries, they do not play with mental health. We neglect it in schools, we neglect it in colleges. In Ghana, mental health is taught in universities. Nigeria has universities of psychiatry and universities of psychology, clinical and counseling. All the World Health Organizational research money for investment in Africa on mental health goes to Ghana and Nigeria and not Cameroon. Cameroon is mentioned nowhere because, first of all, there is no mental health policy. So with me coming back to Cameroon, I am sure that if I work with the government and work with a lot of schools, colleges, prisons, and with the government in place and any other government that's coming up, as a professional, we will eradicate mental illness by 2035.
You want to give out some advice for those who are thinking of following in your footsteps?
Yeah. The humanitarian profession is a nice profession, but it's not for everyone. Because first and foremost, if you think that you are going to get so wealthy with this profession, this is not a place for you. You have to put the human being, human interest first ahead of money. Because this is not a place you are going to become so wealthy. In this type of activity, like going into psychology or psychiatry or social work or rehabilitation counselor or substance addiction worker or a psychiatric nurse or nursing as a whole, you have to first of all be able to lead an example like the lady with the lamb, Florence Nightingale. You should be able to be that type of a person who should be able to pick someone from the street, wash him, give him food, take care of that person, talk to that person, counsel that person, take him to the church and everywhere.
Just have to have
so
a very good
you
heart.
need to have a passion for this field. And if you feel that you are not a humanitarian, don't get into it. As for my young ones who are in school, who do not know what to read to become a psychologist or a psychiatrist or a social worker or a rehabilitation counselor, I will advise them that this is what it takes. It takes some minimal background in biology to understand about lifespan development, human trajectory from birth to old age. You should understand about that. It takes also for you to be a good writer, in the sense that your ability to articulate, your ability to write, and express yourself so well in good English, because you do a lot of evaluation, analysis, and a lot of intake reports, and then you have to go to the field. And it also takes your ability to conduct research, how to be able to measure the variables in the field, quantitative, qualitative research, and how you can able to come up with a hypothesis and prove it in the conclusion, if this hypothesis is proven true or is proven faulty, because that's how your research can lead to a medication invention or a true treatment plan in the field.
We have the impression that psychologists or psychiatrists or social workers, they work so much with people who are zuzot, who are crazy, that at the end of the day, they end up become crazy or having a mental issue as well. What is your take on that? Is it true that you guys end up being caught up in their world?
Yeah, one thing I will tell you is that sometimes my wife even tells me that I'm crazy because of the type of books I read. You look at all the Bibles in front of me. These are all books that I have to read. Sometimes I go to bed very late in the night, at about midnight, and I get up at 4 in the morning because I know there's something I've just dreamt about that I have to research on. Really, the field is a field that has burnout. Burnout in the sense that we get stuck in the client's world. And if we're carrying a load of about 50 patients that you have to listen to stories about divorce, about illnesses, and about somebody who doesn't shower, who is schizophrenic or catatonic or bipolar or major depressive disorder or borderline personality. And if you have to listen to people's stories day in, day out, sometimes you go home with some of these stories. And when you go home with some of these stories, you turn to face a burnout. But what we call, how would we term that in our field? We term that under transference. Transference is the feeling that the patient develops towards the therapist. And counter-transference is the therapist feeling towards the patient. So, in the course of empathy, which we call, we empathize with our clients. Yeah. Empathize. Empathize means the ability to you to transcend and get into your clients' or your patient's shoes, to feel the pain so as to know how to go about treatment planning. Yeah. So somehow along the line, as a consequence of the empathy and as a consequence of the counter-transference feelings, we get stuck and we become overburdened by the loads of our clients that we take home with us or we take to the streets with us. So at the end of the day, some may end up talking to themselves as well. But you need to have a strong emotional resilience. You need to also go for therapy yourself to be a good therapist. I've been in therapy myself.
Okay, thank you. Thank you very much, Dr. Santos. But before we've come to the end of the first phase of the program, and I'm going to take you to the second phase, which is tic-tac.
Thank you.
Dr. Nicolas Santos, your strength.
A very strong emotional resilience.
Your weakness.
I am a bookworm.
One thing that nobody knows about you, neither your wife, your parents, or your children and friends.
I think I've never disclosed to anybody what my retirement plans are.
What animal would you have loved to be if you were not a human, and why?
I think a fox.
Why?
A fox is cunning, and to be able to function in modern day society with humans, especially in my field, you need to be very cunning, because to be able to restore most of the clients that are now living in another world, you need to be in their shoes. And how do you pretend to be in their shoes when you are not? So you need to be cunning.
What do you miss most back home?
Without mincing words, I think I miss the dust in Bamenda, the red dust that I haven't seen for a long time.
The food on your mind?
My regular achu that I used to eat at Santa Po in my Fonquen with a lot of meat. That's my food that I miss.
Back home friends?
I would first of all like to say hello to my family back home, and especially my most senior brother, Mr. Jensko Santos. And I would like to wish all my friends, graduates from University of Boya first batch, and extended family and everybody that is watching the program, and to tell them that I'm doing fine, and I will see them shortly.
You have the opportunity to see how you're faring in your local tongue, in your mother language.
Liebe ta Santos for America. Musu afi timbo bunga mkiyifis ingwa araso mentenze ingwa araze amie tongne so mentenji te minyente zungte mo zungte ma mi yene zo fala mo kwesene ba ma tietanchi ina so mo be doctor bare so abu jinga nyushi ina yama mo kwene mo Cameroon so mente etola.
Music on your mind?
My best music in my mind right now is the music by famous Ndidi Yango that says, you hold your man, I hold my own, says, you hold your thing, I hold my own, says, hold am.
Notigo. It was very interesting having you on the program, Dr. Nicolas Santos, and I tell you, you're very inspiring. You are another out in front guest.
Thank you. Thank you too. Thank you very much. My pleasure. Hope to meet you again.
All right.
Thank you. Bye-bye.
And it's with that we come to the end of today's edition of the program. Hope to see you next time.